Hey, you guys, welcome back for our daily practice questions. As always, I like to get into my introduction and disclaimer before we get started with our questions for today. So, for those of you who are familiar with me, hey, y'all. For those of you who are new here, welcome, welcome, welcome. I'm Dr. Brittany Weinstock. I am a family nurse practitioner, and I'm the founder and CEO of the Nursing Studio. I provide resources, tools, review books, courses, and more to assist nurses as well as nurse practitioners with success on their exams as well as in practice. I've been doing this since 2015, assisting nurses and nurse practitioners internationally with exam success, and I would love to assist you as well if needed. Now, I always give a disclaimer, a reminder that we know there's no absolutes in medicine. We treat on a patient by patient basis, and any of the questions that you see, I have created and designed based on the guidelines that are currently being tested on the ANCC as well as AANP exam. Now, any of my videos that you may see, if I'm speaking on things that we currently do in practice, I will always say that so there's no confusion. But with that being said, let's get into question number one for today. Question number one states a patient presents to the office today with complaints of pain to his right foot near the third and fourth toes. He states that he stands a lot for work and periodically it feels as though he is walking on a pebble. Upon examination, the nurse practitioner notes some tenderness to touch. Based on these findings, how should the nurse practitioner diagnose? Is it A, plantar fasciitis, B, Morton's neuroma, C, a meniscal tear, or D, fracture? Take a moment and tell me what you got in the comments. All right, you guys, I always recommend reading the stem of the question first. This allows you to slow down and truly answer what they're asking you. Sometimes we rush and we read these lengthy scenarios and we create our own storylines, and you skip something, miss something, or create our own story, right? So, the stem of the question here states based on these findings, how should the nurse practitioner diagnose? And I always say if it's asking you how to diagnose, you need to run it back and look at the assessment findings. How did they present? What are the signs and symptoms? What are they complaining of? What did you notice as the provider, right? So this patient came into the office complaining of pain to his right foot at the third and fourth toes, states that he stands a lot for work and it periodically feels like he's walking on a pebble. Upon exam, the nurse practitioner noticed some tenderness to touch at that third and fourth toe on the foot, right? So classically, that is a presentation of Morton's neuroma. That specifically, that location, third and fourth toes, are commonly noted for pain for Morton's neuroma, but also that statement of feels like you're walking on a pebble. That's classic for Morton's neuroma. You know what I say. When I say this, you say that. When I say feels like I'm walking on a pebble, you say Morton's neuroma, right? And I always say Brittany's brilliance, my crazy thoughts. The way I remember that is I think of Morton salt, like a grain, a pebble. Morton neuroma, Morton salt, walking on a pebble. Might be far fetched, but anyway, that's how I remember it. All right. Question number two. The nurse practitioner and NP student are discussing migraines. The NP student is inquiring about prophylactic therapy. All of the following are options for migraine prophylactic therapy, except is it A, propranolol, B, sumatriptan, C, Depakote, or D, Elavil? Take a moment and tell me what you got, you guys. All right, you guys. So, stem of the question states all of the following are options for migraine prophylactic therapy, except. Remembering this is also key while we want to look at that stem of the question. So you're not missing those like absolute terms like not, accept, best, initial, things of that nature. So except we're looking for the one that is incorrect, right? So all of the following are options for migraine prophylactic therapy. Which ones are prophylactic therapy? Is propranolol prophylactic? Yes. Is sumatriptan prophylactic? No, that's abortive therapy for migraines, right? So B is the answer. Depakote and Elavil are also are prophylactic uh, therapy options for the treatment of migraine, right? So prophylactic therapy can be any of those things. Your propranolol, your Depakote, your Elavil, whereas sumatriptan is abortive therapy. And I like to throw things like this in here because if they ask you a question, please be sure you're not missing those little terms. Don't miss whether they said, how do you treat with abortive therapy for this, or what is the prophylactic therapy or acute therapy? Make sure you are paying attention to that because you will miss something just simply missing a word. So pay attention, pay attention, pay attention. All right, and question number three. The nurse practitioner notes vesicles in a dermatological pattern. Based on this presentation, what is the best diagnosis? Is it A, scabies, B, Rocky Mountain spotted fever, C, impetigo, or D, shingles? Take a moment and tell me what you got. All right, so the stem of this question states, based on this presentation, what is the best diagnosis? All right, so we need to run it back and see what the presentation is, right? So it's vesicles in a dermatomal pattern. When I say this, you say that. If I tell you vesicles in a dermatomal pattern, hands down, you should think shingles. Answer is D. All right, you guys, I hope you found this helpful. As always, be sure to like, comment, subscribe, and share with whomever you may think may find this beneficial as well. But make sure y'all meet me back here. And if you need any other resources that I offer, contact the Nursing Studio at 803 400 6864. You can also shoot a text message to this number or shoot an email to the Nursing Studio, the number one, at gmail.com. We have a review book option, either ebook or paperback, both linked in the bio of this channel. There is an independent studying option, a self-paced review that is all online with videos broken down by systems, many practice questions for you to complete as well for family and adult general reviewers preparing for the AANP as well as ANCC exam. That also is linked in the bio of this channel. I also do 5-week review courses. It's a group course. We do it periodically throughout the year. The next one starts on June the 10th. There is one additional space available for that. That is linked in the description of this video. So if you want to join, get in where you fit in. I would love to have you. And then lastly are my one-on-one sessions. And I always say, because they are customized and structured based on your needs, whether you're just looking for a session to help you get your weaknesses under control for strength, if you're doing an exam readiness assessment, or if you need a custom plan to help structure your studies after being unsuccessful and having me to work alongside with you during that duration to prepare for boards. Those are various options of the one-on-one style, but because it's so customized and based off of what you need and where you are and how long, I always say either give me a call or shoot me an email so we can gauge what you need and plan accordingly, okay? But reach out to me and shoot me a message, give me a call, shoot me an email if you need me. But as always, make sure you meet me back here. Happy studying. Bye, y'all.